Thank you to the Tennessee Justice Organization that works with us and our partner. Last night, the Senate Agriculture Committee released the bill language related to the SNAP and other issues in its jurisdiction for the budget reconciliation bill. This marks the first official act by the Senate in response to the House-approved version. The bill language released by the Senate Ag Chair John Bozeman tracks closely with many of the changes in the House bill. We all know that the House bill is very harmful to SNAP and to Medicaid, but also moderates some of those cuts. The Senate Ag Committee estimates that the proposed cut will result in $211 billion reduction to SNAP over 10 years, as compared to the $295 billion reduction in the House. At Second Harvest Food Bank and at Feeding America, we are very concerned, and the reason that we are seeing our neighbors saying to us that they are seeing rising grocery prices, rising hunger. As the cost of food skyrockets, as Feeding America has reported, many families are struggling to afford food and other necessities, and food banks are having to fill the gap. We know that if these cuts are approved, we cannot fill the gap at Second Harvest Food Bank. We cannot fill the gap on a national level with Feeding America food banks. Without federal assistance, the hunger crisis in the U.S. will worsen. We hear so many stories. Do I pay the lights or do I pay rent this month? Do I buy gas to work or risk running out of fuel to buy enough to feed my family this week? These are the types of tough choices that many people in America are making each and every day. And I'm reading this from Feeding America. These are comments from neighbors throughout the nation that are faced with these challenges each and every day. Millions of people in America and Northeast Tennessee. And so at Second Harvest Food Bank, we are working together with our partners to make sure that our neighbors have enough food to eat. But we are very concerned about this legislation. And the reason that we are very concerned about this legislation, this is the most harmful legislation in the history of Feeding America and this food bank. These are the deepest cuts to SNAP that we have seen in the history of this organization. And so we have made numerous calls. Our partners, which are food pantries and soup kitchens, have also made calls to our legislators to talk to them about the concerns that they have. And so we want to also stand with our neighbors, our organizations today to say that these harmful cuts will affect our community. They will affect our neighbors in need. And we want to urge our elected officials to not make these cuts, these harmful cuts that are lasting for the next 10 years. And they will be lasting, and the lasting effects to the individuals that we serve will be very harmful to our community and throughout the nation. Thank you.
All right, we're going to invite up Bridges East for the deaf and hard of hearing, Carrie Jo Weltley, and I did not introduce Andrew Metcalf, who's doing the interpreting.
Good morning. My name is Carrie Jo Welty, and I'm the interim director for Bridges East here in Northeast Tennessee, with Bridges for the Deaf and Hard of Hearing. Jack is a client of Bridges for the Deaf and Hard of Hearing. Jack is 40 years old, smart, and capable. He wants to work with computers, but mostly he just wants to work. He seeks employment constantly, trying for positions in computer, retail, law enforcement, and many more. Many potential employers dismiss Jack because he's deaf. The jobs he finds are in warehouses, janitorial companies. It's honest work, but none of them offer full-time employment or living wages. So Jack is dependent on Medicaid to have health insurance. He lives at the poverty line and receives $29 a month from SNAP. Sophie is a 20-year-old young woman who is deaf. Due to complex lifelong medical conditions, she uses a wheelchair. She's bright and curious, quick to smile and laugh, eager to join in whatever is going on. What happens to Sophie without Medicaid? If she is cut off from life-giving health care and community programs that really give her a future. Jess is a 24-year-old young woman who is hard of hearing and who has autism and intellectual disabilities. She is blessed with a mother who is a strong advocate, and she is engaged in educational and work training programs and community engagement programs to help her have a future. Recently, Jess started feeling unwell, and a day later, she almost completely stopped communicating, unable to answer even basic questions. At the hospital, her blood sugar was over 500. She had pneumonia. Her oxygen was in the 80s. In recent weeks, she's recovered from being so sick and has learned to give herself insulin shots to manage her newly diagnosed diabetes. But without Medicaid, Jess isn't still with us because she wouldn't be able to afford the medical care necessary, and she would lose access to supports to help her work and engage in her community. Now, the third person I want to talk about, these three people, Jack, Sophia, and Jess, are not lazy. They are not waste. They are not fraud. They are human beings, citizens, neighbors, and for people of faith, lives created in the image of God. Before critical, life-saving, and life-giving resources are cut or taken away, let's be sure we know exactly who we believe doesn't deserve health care or food. In the meantime, let's do unto the least of these and love our neighbors as ourselves. Thank you.
All right, thank you very much. All right, next you will hear from Dr. Tammy Henderson. She's with the Caregiver Coalition, and I welcome her to the podium.
Good afternoon. I am the president-elect of the Board of Directors for the Tennessee Caregiver Coalition, and I stand before you today on behalf of more than 1 million family caregivers across the state of Tennessee. Caregivers are individuals caring for older parents and persons with disabilities, including children. They are persons caring for family members with chronic illnesses who need ongoing care, loved ones recovering from injuries, grandparents rearing grandchildren and grandparents, siblings caring for siblings, and family members who require end-of-life care. Across the country, 53 million citizens receive ongoing care from loved ones. 1 in 5 citizens are caregivers. Family caregivers contribute an estimate billions and billions, 600 to 800,000, $800 billion in essential, often unpaid labor each year. They are essential workers in a 365-day job of service, love, and exemplary family values. They sacrifice their incomes, their careers, their health, and sometimes even their homes. Caregiving is the invisible infrastructure that holds our families, our communities, and the healthcare system together. The proposed cuts in requirements for Medicaid and SNAP will have unintended and harmful consequences, ignoring the realities of sacrifice and of the costs associated with caregiving. Here are some Medicaid facts. In Tennessee, 1 in 5 adults are caregivers and many rely on Medicaid. Almost 20% of Tennesseans are enrolled in the state's Medicaid program, TennCare. For caregivers and their loved ones, Medicaid covers essential services like home health and respite care, transportation, and medical supplies. These services help keep loved ones at home and not in costly institutions. Family caregivers face difficult choices. Some caregivers are in the paid workforce while delivering sacrificial care to others. Across the nation, more than half of caregivers work full-time while caring for loved ones. In our state, caregivers are almost evenly divided between men and women. Caregivers leave jobs and careers, or they reduce their work pay to care for family. Now, the current policy changes may result in caregivers finding full-time employment and working what we call the double shift, paid and unpaid work. They will also lose access to healthcare services, and those access declines will affect industries like healthcare. The proposed cuts to and requirements of SNAP would take food away from families who are already struggling to make ends meet. We know that 12% of households in our state do not have access to enough food, not to mention the lack of nutritious foods. A caregiver shared this with Dr. Megan Schwarm, the president and CEO of our Tennessee Caregiving Coalition, and I state, SNAP is the only reason I can buy groceries after paying for my son's medications. If they cut that, we don't eat. In summary, the consequences of these policies result in the loss of health care coverage, decreases in food access. It undermines long-term care systems. It increases the risk of poverty, and it forces vulnerable people into institutions because there's no one to care for them at home. These are some facts. The invisible, unpaid labor of family caregivers saves the healthcare system billions each year. Family caregiving is another cornerstone of our state and our country. There is no hard evidence of job creation via these policy changes. We need facts. The Raise Family Care Act and the National Strategy to Support Family Caregivers were policies that use our tax dollars to support caregiving responsibilities. What is the charge? Let us reinvest in the infrastructure of care that keeps families together, reduces healthcare costs, and increases access to food. We care about family caregiving and economic stability. Let us demonstrate that family caregiving policies are rooted in family values. Let us support the invisible, essential, and often unpaid work of family caregivers. It is a pleasure and honor to be with you as we address these compelling issues and needs of family caregivers. Thank you.
Thank you, Dr. Henderson. All right, now we're going to hear from a parent advocate who has experience with the healthcare system with TennCare. I want to invite up Ashley Elliott.
Good morning, and thank you for giving me a moment to speak today. My name is Ashley, and I'm a single mom from Kingsport, Tennessee. I live in District 1. And I'm here not to ask for sympathy, but to speak survival. I'm here because TennCare is not just a program to me. It is the difference between my children living or dying. I have two beautiful, brave children with very complex medical needs. They suffer from multiple chronic conditions such as Ehlers-Danlos syndrome, POTS, eosinophilic esophagitis, diabetes, thyroid disease, and one of my sons even has a mass in his digestive tract that is too risky for most doctors to remove. Our lives revolve around specialists, hospital visits, medications, feeding supplies, and therapy, physical, occupational, and speech. TennCare is what makes that possible. It doesn't make us comfortable, it helps us survive with dignity. I work hard, but when I started earning a little more, The system penalized me. I lost support, and I was told I made too much for benefits, but not enough to cover the cost of my children's care. My small raise didn't cover even the rising cost of gas or groceries, let alone doctor visits and medications. It felt like I was dropped in a deep, slick-sided well, one I can't climb out of no matter how hard I try. I feel punished for not trying to do better, for trying to provide. It is not just my kids. I have my own medical struggles. I have Chiari malformation, chronic migraines, nutritional deficiencies, and much more. Because I can't afford the food our doctors recommend, right now I'm getting iron infusions. My children are on multiple supplements, and if we had access to healthier foods, we would need fewer doctor visits. That's not just better for us, it's more cost effective for the system too. Recently, my son asked me, "Mom, if they cut Medicaid, we will lose it." I told him maybe. He said, "So then I'll die." What is a mother supposed to say to that? This is why I'm here, because I'm not only one. I am one of thousands of parents, caregivers, and working Tennesseans who rely on TennCare to stay afloat. We are not lazy. We are not irresponsible. We are doing everything we can, and it's still not enough. Not without TennCare. I understand hard decisions have to be made, but cutting essential programs like TennCare and food assistance won't fix a budget. It will push people into hospitals, into crises and disability, and into deeper poverty. It will cost lives. It will cost us our humanity. So I'm asking, begging, do not make these budget cuts, because TennCare is not a handout. It is a lifeline, and without it, families like mine don't stand a chance. Thank you so much for your time.
Thank you. If there is room for questions in the press conference, and when we've done these in the past, there have been follow-up questions. So I want to invite everyone who presented to come back up here, just in case folks in the audience have questions.
I'll ask one question. You have the House bill with some details around it. Does it give you a lot of clarity on exactly who would lose benefits and who wouldn't lose benefits, or is that still a little bit of a difficult question to answer real precisely?
Yeah, I think it's fairly clear that families with children who in the past didn't have to adhere to work requirements, they're going to start losing benefits because now if a mom has to stay home and take care of her kid, and that's a job that's not counted as work and should be, right? Parents with children will lose access. They're expanding work requirements to older Americans as well. So right now it's up to age 54, and they're looking to increase that to up to 65. So seniors who have not had to adhere to work requirements will now have to adhere to work requirements. So they'll lose benefits. And then the other big piece is the state cost share. So states have never had to pay out of the state budget for SNAP benefits. That's always been the federal government. Those are our federal dollars coming back to us. And now they're changing that. Both the House and the Senate bill is looking for the states to pay a portion of those benefits. If the state can't pay, then people will lose their benefit. I don't think we have exact names of people, and we do have an estimate of numbers, but it will be significant. Like Rhonda said, these are the largest cuts we've ever seen to the SNAP program, so it will have an impact in every county across the state of Tennessee. Everyone will be impacted.
So Tennessee gets us, last fiscal year, Tennessee got X amount of SNAP funds to its citizens. Let's say that was $300 million. I don't know. What's that breakdown that they're trying to say needs to be cost share? Do you happen to have that?
Yeah, the 2024 estimate was $1.6 billion in SNAP benefits came to families across the state. The Senate bill is looking to lift that up to 15%, so the state would be responsible for 15%. So 15% of 1.6 billion, that's a lot of money when in the past the state budget has been zero. And for folks who do any sort of advocacy and trying to pass bills, if there's any sort of price tag attached to it, it's hard to get that money. So finding the money for SNAP benefits, 15% of 1.6 billion, I think is going to be a real challenge.
And that is that's exclusive of other changes and cuts and elements of SNAP, right? That's just one
piece, right? Because in addition to that, the state has always paid 50% of the administrative cost to the SNAP program. So states always pay a portion of what it costs to run a program like the SNAP program. And that's another thing that's been lifted. It's going to be a higher cost to the state. So we're moving from 50% to 75%. And that's the same proposal in both the House and the Senate. That doesn't change. So that's another additional cost of millions of dollars that the state will have to find in order to just administer the program.
Has the Tennessee Justice Center?
Tennessee, yep, I'm with
Has
the
the
Tennessee
Justice Center been talking to either the Lee administration and/or state legislators about, hey, do you have the votes for $240 million if I'm doing my math right?
Yeah.
Just to match that.
Yes. So we haven't reached out to them directly yet, but we've been talking about it. I think the house is on fire, so to speak, in that right now the focus has been very much our Congress people, because they're the ones that are operating this. But yes, you're absolutely right. We've been talking to a lot of our partners and individuals across the state about sharing what the reality is for our state, and so we are going to do that. From the audience. Chris.
With the Senate bill announced yesterday, how can constituents reach out to advocate against these cuts? What can they do to affect this?
Yeah, so the best thing to do is reach out to your senators right now because it's in the Senate. And the best way to lift this up and share the actual impact of it is by sharing stories. So you heard from Ashley Elliott, you heard from caregivers and the folks up here who have direct experience with clients. And so I think lifting those up and making sure that senators know what the actual impact is to people is the most important thing to do right now. Yes.
You said you might have estimates on how many people in Tennessee could be affected by these cuts. Do you mind sharing them?
Yeah, I will follow up with you, so I'm not just sending out a wild estimate without.
Second Harvest is part of the Feeding America Network, and they are reporting that it's 4 in 10 individuals that will be affected by the cuts. So that's on a nationwide level, but on a local level, we haven't been notified what those cuts will be.
Okay. And are you talking about SNAP specifically, or?
We're talking about SNAP specifically. We don't have any Medicaid information that they passed down to us.
And is the food bank taking any steps in preparation to perhaps expand capacity, and if the bill is passed the way it is?
I mean, we obviously are talking about strategy. We always talk about strategy to be able to meet the increased needs. We've already seen, since they released the food insecurity rates in May, we saw a significant increase. We have over 90,000 people that are food insecure in Northeast Tennessee alone. And so we know that that number has increased significantly as compared to the last estimates. And if we have to, really meet that need and be able to fill that gap, I think it's going to be very difficult. I don't think we have the resources to be able to do that. We've already cut our operational budget this year. We did not cut our food purchase budget, but we cut we shaved back other expenses significantly because we estimate that quite a few of our areas, specifically foundation, corporate giving, some of those areas have already reported that they're not going to be able to provide us with as much funding this year. And then we've also seen some cuts in some of the other programs, such as some federal grants, some state grants that we've received in the past.
What has been the legislation ability to be reached by you, and have you had any progress in communicating with them in regards of the issues that you're bringing up? Or their empathy in regards of what you're doing?
Yeah, so we, folks from TJC were in DC in May, so we were talking to the House as well as our senators. We were able to talk to, in many cases, we talked to our Congress people directly, and if they weren't available, we talked to their staff. They're listening and they're taking note, and I think it's very important that, that there are people like us and like the folks up here to talk about it, because they have to note that down. That's data of somebody else coming forward to say how this is going to impact them. So they are listening, but I wish they would hear a little bit more, because these cuts are way too drastic. Both the House and the Senate cuts are far too severe for what will happen for families here. Yep.
Do you expect them to have open house communication with the general public or to hearings in regards to this, or you don't think that that's going to happen before July?
I don't think it's going to happen before July. I know there's a recess coming up soon, and so that's a great opportunity to talk to people in their districts. But when they're hunkering down to process this legislation, it's harder to get face-to-face time, but calls are important. If you are able to visit them here when they're here in their district, do it. Any way to speak out, I think, is important at this point.
As an end user of your services, I just want to say thank you for your opportunity that you've given the rest of us to take advantage of these and help the people that we help. So thank you.
Yeah, no, thank you, all of you, for doing what you all do.
Question, maybe for Second Harvest Food Bank in particular, I know that having whole, nutritious, and locally grown foods is important to your mission. I also know that farmers markets take SNAP.
Mm-hmm.
Can you make a comment on the effects of cuts to SNAP and cuts to other local food programs on not just nutrition in households, but also local agriculture that's come to rely on being a solution for food security?
We really have been very excited about the opportunity for SNAP, especially that access in farmers markets, even the SNAP bucks that they can match. Individuals can receive additional produce as a result. I think we're very concerned because, we had an opportunity to participate in the LFPA grant, receive local farm to food bank food that goes to families. That was such a fabulous program. That program was cut. That was a federal program. It was cut. We were also very blessed to receive funding from the Tennessee Department of Agriculture to continue that partnership with the farm to food bank, and we're in that program right now through December of 2026. And that every dollar that they give us goes right back to local farmers to grow fresh produce. So it not only helps individuals that need fresh, nutritious food that many times they do not have the resources to purchase because it's very costly. Bag of potato chips, a bag of apples, which one's cheaper? Bag of potato chips. Whatever they can to fill their child's stomach. They're going to look to try to do that. And so if we can get as much fresh, nutritious, and locally grown produce to food banks, to food pantries, it really helps. I think the more that we can do to help our farmers to sustain their business, to sustain their farm, we need to do that, but we also need to utilize their fresh grown produce here in our community to feed our families in need.
On the economic side, this is very real for the people that we work with, but it also has an impact beyond the folks that we serve. If for many rural communities, folks who participate in SNAP, 40% of smaller grocery stores in rural areas, their revenue comes from the SNAP program. So if folks are being cut from SNAP, that has an impact to that grocer. For farmers who are raising our food, it has impact to them. So it's not just the individual, which, that should be enough. The hunger of the people in our community should be enough. But it's going to have a much larger impact on more than just the individual.
Yeah, economically.
Yeah.
Yes.
All right. Thank you, everybody. Thank you to the presenters, and thank you for everyone who showed up. Thank you.